Hello, good afternoon. I'm Dr. Chen. I work in Australia and I am Malaysian citizen. Today I'm presenting my talk on a case scenario in telemedicine. So as in telemedicine is something new to most countries. In Australia, we've been having it since the COVID pandemic. So in telemedicine, there are limitations as to what we can do. We do history taking and followed by inspection. And if there is not all areas are obviously available for inspection on telehealth. And the vital signs, if there's uh, patient can monitor their blood pressure and temperature, they can tell you what they are, or if there's a third person who's a nurse in the house or some medical personnel, they help you to monitor the vital signs as well. So sometimes it's good to have a third party assist. So I'm going to, as in all telehealth or all medical consultations that are can present as either as an acute, subacute, or chronic. So today I'm presenting of a patient with hearing loss, and this is my approach as a 5 steps approach to this in any telemedicine consultation. The first approach, step one, is always the check. So we always check the 3 points. We ask for the patient's name, address, and date of birth. So in case there is a patient with a similar name and similar surname, but the address is always different and date of birth is always different, and ask for his consent. Age is for hearing, if ask the patient if there's got any hearing or visual impairment. And it's also good to ask whether the patient has got experience with this sort of technology. And we can ask about his memory and whether in case or kins or the third party that is may be involved in any consultation. Step two is to ask the history. So this is actual true history. She's a patient who is 58 years old, and she called me during the 2020 COVID pandemic. So she said she woke up in the morning with a one ear left-sided blocked ear or ear fullness, and it's persisted since then. She has no associated symptoms, but she has a background of high blood pressure and hypercholesterolemia. Step three is to think of common causes of blocked ear, which in this case is either an infections or some wax thing. So infection the ear. So we ask for symptoms of upper respiratory tract infection or ear pain or ear discharge. Um, and fever and any skin rashes as well. Step four is where we test, puts all your medical knowledge into play. So we have to, because based on your inspection and your history, you got to differentiate the few causes in any case history. There are red flags. So I've got this alarms red flag, and if anything that's acute onset, to me is always a red flag. And if there's accident or trauma to the ear is another red flag. And L is for loss of vision or any tinnitus or any other neurological signs, and also it's a red flag as well. R is for rapid decline. So rapid is different from acute, because rapid means wake up in the morning, there's mild hearing deafness, but by the end of the day, there's a severe, so the velocity of the hearing loss is rapid. Reciprocal means bilateral. So bilateral hearing loss is a red flag. M is for malignancy. So there's background of malignancy. So if there's a possibility of metastasis to the brain. And malignant otitis externa is another red flag as well. Severe means that if you do an audiometry and find that the patient has got 40 decibel, anything less than 40 decibel hearing loss is difficult. It means that it's considered as a mild hearing loss. Severe hearing loss, because it's a telehealth consult, we will ask them that if you can hear any cars passing by or can hear the phones ringing. So if they can't hear, then it's a severe uh, hearing loss. So we normally use different criteria to differentiate severe hearing loss by telehealth. And then we do a test, step 5. We do know that from medical school, there are two types of hearing loss. It's a conductive and a sensory neural hearing loss. So we can do a hum test. Hum test means patient goes to the room, sits alone in the room and hums to himself. So he can hum a birthday song, he can hum, and it's same as a Weber's test. So you use it's same as Weber's test. It could be heard, should be heard equally on both ears. But in hum test, you can actually differentiate between a conductive and sensory neural hearing loss. Second technique used is a smartphone-based vibration test, and that also can be downloaded in your iPhone 6, and you can actually differentiate again between conductive and sensory neural hearing loss. So I've devised this 5-step approach in telehealth and use hearing loss as a primary symptom, but in any telehealth consultations, whether it's chest pain, shortness of breath, we can use the 5-step approach and to approach to any telehealth consultations. So these are the examples of a course that's coming. So course will be a few common causes of conductive hearing loss and sensory neural hearing loss. Coming is a mnemonics for common causes of sensory neural hearing loss. So this patient was actually found to have sudden sensory neural hearing loss. She was then started. At that time of the COVID, I asked her to come in and do an audiogram, and we found that she fits in the criteria for sudden sensory neural hearing loss. She was then started on prednisolone, which is 1 milligram per kilo per day for up to 10 days, and she was started on the maximum dose was 60 milligrams. And 80% actually recovers after a month, and she's fortunate that she started early with prednisolone. This is a table showing that this is the hearing loss based on the audiogram. But this is using a telehealth, you can actually differentiate between a mild, moderate, severe, and a profound hearing loss. So you will document in your case notes what's your diagnosis, differentials, and if any investigations is necessary. In her case, this nurse, we did an MRI brain just to rule out any tumors in the brain and also rule out any cerebral vascular events that can contribute to the sudden sensory neural hearing loss. This is a algorithm of approach to sudden hearing loss, but this is obviously it's used when the patient is available to come in and do otoscopy and tuning fork test and audiogram. The 5-step approach is my approach to any patient with sudden hearing loss and for any other complaints in primary care consultations. And these are the rule of 3 in sudden sensory neural hearing loss, rule of 3. So there's 30 decibels, 3 times 10, about 3 consecutive frequencies, and within a 3-day